need to get thinner gets ever more urgent, I'll be asking who we can really trust to help us.
Ultimately, it's up to people to decide whether they want to trust the food industry, who are only interested in your money and making profit, or doctors who are only interested in your health.
In February this year, a committee of experts put together by the Academy of Medical Royal Colleges issued the outcome of a year of investigation into how we go about tackling our weight problems as a nation. The message from the report was clear. There's no silver bullet to getting us thinner. It will require a series of different interventions, but none of them can happen without the cooperation of government. The report suggested action on weight management, education, nutritional standards. 6 of its 10 recommendations specifically involved the food environment, including a 20p tax on soft drinks. Cardiologist Dr. Aseem Malhotra was on the board who put together the paper. What was the response from government to your report?
Unfortunately, there has not been any kind of intervention that the government have implemented based upon our recommendations. At the moment, nothing has happened, and we're still waiting for them to respond positively.
And how did you feel by the fact that the government hasn't responded?
We were extremely disappointed. We feel the government has a duty and responsibility to protect the welfare of its citizens and our children. And by not implementing any of the recommendations so far, and we mustn't forget every single day that goes by without an intervention means more and more people are suffering the problems of diet-related disease. We feel it's a dereliction of duty of this government.
Why do you think government didn't respond?
I think they want to devolve responsibility back onto the individual. There's also corporate influence on the government.
What do you mean by that?
Unfortunately, what we have now is the corporate capture of public health. The government's behaviour is more that they care more about the profits of the food industry than they do about the health of our adult population and of our children. We asked the government if they wished to come and talk to us. They refused. Instead, they provided a statement. They agreed that there is no single solution to obesity and said that they've shown real leadership working with the food industry through their responsibility deal and programmes like Change for Life and the soon-to-be-launched front-of-pack food nutrition labelling scheme.